Musical performance leads to a higher effect on cardiac autonomic nerve activity than music perception. Greater levels of heart rate and low frequency components of heart rate variability were noted during performance rather than perception of music in a study from Japan conducted on 13 elite pianists. Another study was conducted on 40 patients undergoing coronary artery bypass grafting and/or aortic valve replacement. The methods used to assess relaxation on the post-operative day were plasma oxytocin levels, heart rate, mean arterial blood pressure, PaO2, SaO2, and subjective relaxation levels. Oxytocin levels were significantly higher in the group allocated to listening music. Subjective relaxation levels and PaO2 levels were also higher in this group. No difference was noted in the mean arterial pressure, heart rate, or SaO2 between the groups. The author suggested that music should be included as part of the multimodal regime for post-cardiac surgery patients. The study was from Orebro University Hospital and School of Health, Sweden. The same author in another report mentioned that s-cortisol levels were lower in those post-cardiac surgery patients who listened to music, indicating lower stress levels. A systematic review published in the Cochrane Database of Systematic Reviews evaluated the role of music for the reduction of stress and anxiety in patients with coronary artery disease. By an extensive search strategy, they identified 23 trials with a total of 1,461 participants, which could be included for the analysis. 21 of the studies did not use a trained music therapist for intervention. Though there was a modest reduction in the anxiety of patients with coronary artery disease, the results were not consistent across the various studies. The benefits noted were reduction in the heart rate, respiratory rate, and blood pressure. But the review failed to identify strong evidence for reduction of psychological distress.